In this video, I'm going to show you how to quickly self-assess your shoulder mobility so you can determine if it's something you need to work on or if it's one of your weakest links. Before doing any of these movements, I want you to be aware if you have any pain or major discomfort with any of them, just know that's an automatic fail for that test and know that this is automatically a weakest link that you should be working on. Also, before we do any of these movements, I want you to know that you could film yourself doing these so you can get really accurate measurements of where your dysfunctions are. Sheridan's going to be our model for all these movements, and I'm going to take you step by step over all the movements we're going to test here. So the first one we're going to do is shoulder flexion. So Sheridan, I'm going to have you face the side that way, and what you're going to do is just thumb facing forward. You're going to come overhead as far as you can, and what we're looking for is to hit 180 degrees. So that would be her hand having a straight line all the way to her foot, which she definitely passes here. Let's go ahead, face me, and we'll do the other side. Nice, a little stickier on that side, but you definitely hit the requirements. That's a pass. Since we're already standing this way, the next one we're going to do is shoulder extension. So Sheridan, I'm just going to think that you're up against a wall here and you're just trying to like punch someone behind you or slip them a 20. Nice, so we want to hit 60 degrees. So if this is 45, she's right at that 60. That's a nice pass there. Go ahead and let's see the other side. Nice, a lot more mobility there. I can tell shoulder extension is not something she needs to be training. So the next one we're going to do is shoulder abduction. You can actually do both of these at the same time, just so you can really test how both of them feel. And you're trying to bring them up as high as you can, even if you can kind of touch those thumbs together, even the hands. And we're looking for 180 degrees here. So she clearly hits that mark with her abduction, so that's a nice pass. The next one we're going to do adduction. So that's going across midline. So we're going to have arms straight, bring it across, and what we're looking for is 45 degrees. So if this is 45, she's definitely passing on her right side. Let's check the left side. Nice. Even further on this side, again, shoulder adduction is not something you should be training. And then the last movements we're going to test is internal and external rotation. This is where a lot of you might see some movement dysfunctions. So first, we'll face the corner of the wall over there. And then whenever you're ready, let's go left side. We're going to be looking at external rotation first. So let's go over the top. We're just going to see if we can touch that opposite shoulder blade. Nice, you can hit there no problem. If you're filming yourself doing this, you're also looking for any compensations. So if there's any excess movement or you feel like you got to whip that arm over the top, know that that's a fail already. And then let's go ahead and do the same thing on the right side. Nice, you could tell she was keeping a nice still spine and neck while doing this, which is what we're looking for. She passed with that external rotation. Now we're going to go internal rotation. So that's trying to go behind the back and touching that opposite shoulder blade. Really good movement here. And then let's go ahead and do that right side. Nice, a little bit stickier on that side, but she hits that. But if she's right-handed, a lot of times you'll have more limitation in this movement, whatever hand dominant you are. But you pass, that's all I care about. Extra credit here, you could do both of these movements at the same time, and if you touch your fingers together, know that your shoulder rotation is not a big limiting factor for you. So when you're ready, nice, easily touching on that side, extra credit for you, and then boom, just getting there. So if she has a little bit of restriction, it's not much, but if she's gonna do some sort of upper body warm-up, if she worked in some rotational warm-ups, she's gonna be doing just fine. So again, for the best results, you'd wanna film yourself doing these or have a partner nearby to grade you. And if you failed a lot of these, then know shoulder mobility is a weakest link that you need to be training. So check out my shoulder mobility programs within the membership.